Welcome back. As the number of coronavirus cases grows across our nation, one major city has managed to avoid a sharp rise in infections and deaths. I'm talking about San Francisco. They have reported just 9 deaths and just over 580 infections of the virus to date. Compare that to New York City with 2,700 dead and more than 67,000 people infected. Both cities announced their first confirmed cases of coronavirus at the beginning of March, within 4 days of one another. Of course, you must keep things in perspective. New York does have a significantly larger population than San Francisco, more than 8 million people compared to just 883,000. Joining us now, Dr. Sam Hawgood. He is the Chancellor of the University of California, San Francisco. Thank you so much for joining me. San Francisco sheltered in place very early. How did your city manage to keep infections at such a low rate?
Good morning, Stephanie. I think that the very early shelter in place was exactly what has blunted the curve here in San Francisco. Very brave, heroic decision-making by our Department of Public Health and the mayor of San Francisco. In fact, the mayors of all of the Bay Area cities and counties made that decision on the 17th of March, just a few days after the very first case. And in the case of San Francisco, fully 8 days before the first death from COVID-19. So that social isolation early and persistent, I think has helped blunt the curve here in San Francisco.
You arrived in San Francisco in the early 80s, and your university played a major role in combating the AIDS crisis. Talk to us about how that experience helped prepare your city, you, to combat this current pandemic.
I think many of the leaders of the public health agencies throughout the Bay Area were in the AIDS epidemic in the early 80s. They saw what a novel virus could do in the community. They reacted then heroically, and I think it gave them tremendous experience to be ready for COVID-19. They saw a new virus entering our community and knew that early and courageous action was necessary in order to get ahead of the curve. The experience of the AIDS epidemic in the early 80s rallied the entire city and county of San Francisco, and the university that I serve was at the very forefront of that, establishing new modes of therapy, understanding that we needed to treat this as any other medical disease, roll up our sleeves and do the research that was required to find a cause, and then look for new therapies. And that experience, I think, has helped us now, some 40 years later, react early and with courage for COVID-19.
Well, we're turning to you again for that research, for those new therapies. Talk to us about some of that work being done right now and the role that universities and academic health centers are playing in a time like this.
It's been very exciting to watch our community rally around this. We shut down, as part of shelter in place, effectively all of our research community, with the single exception of those people that pivoted immediately to focus on COVID-19. And some of our best minds who were previously working on cancer, cardiovascular disease, switched over to work on COVID-19 research, whether it was next generation diagnostics using CRISPR technology, which was born right here in the Bay Area, to turn around rapid testing. Could we repurpose existing FDA-approved drugs to tackle COVID-19 by mapping all of the interactions between the viral proteins and human proteins? Could we turn to immunologic therapy, look for those patients who had recovered but had very high titers of neutralizing antibodies? All of these things are underway, and are underway at a pace that I think could make an impact in this particular cycle of the pandemic. It's just been amazing to watch. The other thing that's been very exciting is the collaborative nature of this research. We've reached out across the great universities of the Bay Area, Stanford, UC Berkeley, but also across the country and in fact around the world, to look for collaborators who can put teams together to make a difference in an incredibly rapid period of time. Super exciting.
Well, that absolutely gives us a renewed and urgent sense of optimism that we need so much right now. I really appreciate you joining me at this very early hour in San Francisco. Thank you so much. We're going to leave it there.
Thank you, Stephanie.
And in the state of Wisconsin, thank you.